and to craft what is it that we're trying to achieve in emergency care. And so a statement for the vision for care really begins to reflect it is about partnership, it is about caring, it's about positive relationships even in difficult situations. And I will tell you happily, since we did that our patient satisfaction scores have risen dramatically in the emergency department now that they have active patient advisors working day by day with the management, the physician leaders for that department. Here's another place. This was a super frontline staff member in emergency services, Charles Wilbur, who began to learn about patient and family-centered care, and he said, I know what I can do right away. And what I can do is use the whiteboard in the exam room in the emergency room to help with communication and with patients and families. And so patient came into the exam room. His name was there. If they started lab tests, he wrote those down on the whiteboard. If the next thing that was going to happen was the patient was going to go for a CT scan, that was down there. So then when Charles had to walk out of the room, the family could actually convey to the next person that came in what was in fact happening. The family was right in the loop with all of that care. Here's another example in the MS clinic where a group of a neurologist, a hospital administrator, and MS patients came together, and they began to compare what they both were thinking about on quality improvement. The doctors were thinking about curing MS, which is a laudable and important goal, but what the patients said when they first sat down and met with them, and this is back in 2002, is, well, that's important, but this is what we really want. First of all, when we call you, we want you to call us back. Secondly, we can't use the bathroom in the clinic. Our wheelchairs, our walkers, they don't fit in that thing, so please repair it and fix it. We want psychological support when we come because MS affects our whole total neurologic system, including our mental health status. So we want psychology to be part of the experience we have in the MS clinic. But most of all, what we want is for you to help us manage our independence over a lifetime of this disease. That completely changed the focus of care for MS clinic and frankly resulted in a dramatic improvement in the numbers of patients. There are 2,500 patients being followed in the MS clinic today, 99th percentile, top percentile of patient satisfaction in the country. Now, are there barriers to patient and family-centered care? Yes, there are. What are they? Well, mostly they're in attitudes that we as healthcare providers have developed over many years. One of the biggest attitudes that's a barrier is this attitude that we know best. We have all the answers. Patients just come to us and we will take care of you. And that can become a stumbling block to really listening and valuing the patient's input. Education can be a barrier. That's why the Medical College of Georgia is absolutely devoted to transforming the education of all health professions so that they are and do become patient and family-centered. And there can be organizational barriers. You can have policies and procedures that prevent partnerships. One of the biggest ones that happens in the United States is HIPAA. We call it the HIPAA hammer. Whereas HIPAA really was trying to give patients more control over their healthcare information. In a lot of cases, it ended up really preventing patients from getting access to the information they deserve and need. Now we have another question for you, and that question is, what barriers do you think exist to implementing patient and family-centered care in your organization? So are we going to, can they see it? They can see it. Okay, and the questions, the options you have are lack of education, attitudes such as providers know best, organizational or systems, or absence of leadership for patient and family-centered care. Here we go. Here it is. So we'll give you a few seconds to see if you have some ideas and what you think barriers might be to implementing patient and family-centered care. Okay, we're still voting. All right, and it looks like a number of you think that the attitudes probably are the dominant barrier. And so this should tell you that it takes a good amount of education and leadership to help shift those attitudes. But one of the things it also takes a lot of is really hearing the voice of the patient. And you're going to hear Nettie Engels right now talk about a little bit what her role in our health system has meant. And before we do that, just a final slide on what's in it for me. And one of the things I really want the audience to understand is that when we started this work way back in 1993, we were trying to improve the experience of care for patients and families. But what we've learned is that our healthcare professionals have been the biggest beneficiaries of patient and family-centered care, that our healthcare professionals reconnect with why they got into healthcare in the first place. It fosters their creativity. It fosters teamwork. It reduces risk. We have an incredible track record, and I'll show it to you later, on malpractice in our organization. So now what I want to do is turn it over to my friend and colleague, Nettie Engels, to tell you a little bit about her work as a patient advisor.
Thank you, Pat. I appreciate the chance to be here today and to work with you, and hope to provide some answers that you may have and some questions. You may wonder who I am. Well, I am a wife of 42 years. I am a mother of 2 grown sons. I am a grandmother of 3 delightful grandchildren. I'm a sister. I'm an aunt. I'm a cousin. I'm a public school educator who's actually just retired. I was a high school science teacher and an assistant principal, a principal, and then in the central office for many years. I'm also a community leader. I'm very involved in my church, where I'm a deacon, and then I work on some other committees in the organization. 5 years ago, I was diagnosed with cervical uterine cancer, and because the military hospital in Augusta did not have a GYN oncologist, I was referred to the Medical College of Georgia, where I received excellent care. And I am here today simply as a cancer survivor who wants to give back to medicine as a whole, but especially to the Medical College of Georgia for the excellent care that I received. You might want to know, how do patient advisors help you? What do we do? Well, one of the things is many of the councils, MCG has many patient advisory councils. There's one overarching council, which is called Health Partners, but now there is a patient advisory council in almost every clinic in the hospital. We also have a process known as family faculty, and on the family faculty there are patient advisors who are willing to go and actually teach classes in the Medical College of Georgia. I usually teach each fall the freshman medical students, and we do a session immediately after they have been taught how to deliver bad news. We go in and talk with them as patients, and of course one of the things they want to know is, how did you find out you had cancer? How did you find out that this was going to happen or that something else was going to happen? I also speak to critical care nurses and to freshman nursing students here at the Medical College of Georgia. We also serve on interview committees I was on the interview